Indian Healthcare and Organizational Culture, a Review. Abstract organizational culture is a set of combined principles, values, and beliefs that are determinants of how individuals act in an organization. An organization's culture consists of common beliefs and values that leaders establish, which are communicated and emphasized using different methods, ultimately aligning perceptions, behaviors, and comprehension of employees. This article is on defining and interpreting the organizational culture in the Indian healthcare industry and how the performance of health facilities is affected. The study is done through thorough analysis of secondary data and scholarly research on organizational culture, with more highlights on healthcare. The objectives of this article were to explain in detail what makes up the organizational culture in Indian healthcare facilities and examine the impact of how organizational culture affects overall performance and delivery of healthcare in the country. Related literature was carefully analyzed, and this revealed that in hospitals, organizational culture has tremendous influence on the staff relation, patient overall satisfaction, and a bulk of the processes which go on in the organization. There is great room for more academic and research studies in the area of organizational culture, especially in the healthcare sector, and more attention should be given to the involvement of all stakeholders in contributing to patient care and quality delivery of health services in all facilities in the country. Keywords: organization, culture, principles, healthcare, hospitals, satisfaction, performance. Introduction. The expression of life of an organization lies in its culture, thus organizational culture can be likened to the personality of that organization. 1. Culture differs from one to the other, and no two distinct areas are likely to have the same organizational culture. An immanent part of humans is culture, and this manifests in different forms such as national, regional, organizational, department culture among others. 2. Healthcare has evolved from home remedies, traditional medicine, and practices to systems of complex and sophisticated procedures and technologies. Development is dependent on the lasting culture that is prevalent in the organization, as it tends to be a pivotal player in the development. In an organization, culture directs and shapes the way and thinking of staff of the organization. There are significant variations among managers in the private, public, and international sectors. Organization culture profile can provide a reasonable mapping of organization culture. Commitment of employees is found when their values are similar to those of the organization. 3. Behavioral norms and values encourage activities that represent the expression of organizational culture. 4. Organizational culture. The culture of an organization identifies the appropriate way to behave within the organization. This consists of common beliefs and values that leaders establish, which are communicated and emphasized using different methods, ultimately aligning perceptions, behaviors, and comprehension of employees. Organizational culture sets the basis for everything done in an organization. 5. 3 distinct levels of organizational culture were laid out by Edgar Henry Schein: artifacts and behaviors, espoused values, and assumptions. He also indicated organizational culture as the most challenging organizational attribute to alter. 6. There exist 2 key disciplinary foundations of organizational culture, thus the sociological and anthropological foundations. The sociological believes that organizations have cultures, whereas the anthropological believes that cultures are organizations. 7. For each of these foundations, 2 separate approaches to culture have been developed: a functional approach in which culture derives from collective behavior, and a pragmatic approach in which culture consists of individual perceptions and understanding. 8. Healthcare organizational culture. In healthcare organizations, vision statements, mission statements, organizational structure, management approaches, and other factors define organizational culture. Organizational culture is associated with outcomes of patient care such as mortality rates, readmission, patient satisfaction, clinical outcomes, hospital-acquired infections, and more. 9. Care in health facilities with less effective staff cohesion put patients at greater risk outcome challenges, compared with facilities with more effective cohesion. 10. A hospital with shared culture may emphasize working as a team, while consistency and cohesion flourish in a more controlled culture. Competition-based culture needs to operate plainly and be change-sensitive. Creative culture, on the other hand, promotes innovation, risk-taking, and individual resourcefulness. 11. Objectives. Working with these objectives in mind, this paper seeks to bring to understanding composition of the organizational culture in Indian healthcare facilities. Examine the impact of how organizational culture affects overall performance and delivery of healthcare in the country. Review of related literature. The hospital's organizational ethos can be seen in its facilities, organization process, vision, and mission statements. 12. Culture in the hospital depends on the output of the workers. Organizational culture in healthcare relies on the type of patients, physical discomfort, managerial types, emotions, and the actions of staff. There are major gaps between private and government hospitals. The hospitals do not expect benefit from the government sector, yet still provide services for patients. Private hospitals are run in order to make something out of them. There are certain cultural characteristics in any hospital that stress clinical and non-clinical staff. 13. The organization will be profoundly influenced by the cultural forms of the organization. Some contribute to the results being down because of economic issues. The organization can be defined according to management and human resource. 14. Institutional heads and managers have duties that are very vital and pivotal in planning and delivering of quality healthcare to the public. Research was conducted amongst managers, which revealed that organizational culture stems from complex processes contrary to old ideologies. The culture affects how healthcare is delivered and the quality of care delivery. Care delivery excellence, right and ethical values, participation, expertness, value for money, fealty to delivery of quality and strategic thinking are some of these influencers. There is however a disparity between delivery of quality healthcare and cost effectiveness. 15. In comparing group and non-group cultural elements in a study, researchers found that group elements contributed positively to the care of patients, while non-group elements led to negative interactions and outcomes. Flexible management, unity, and teamwork contribute as group elements. Leadership conflicts, complacency and hierarchy fall under non-group cultural elements. 16. The Government of India has not focused much research in organizational culture in the health sector, especially when it focuses on the core organizational values. Using ACAPACE, openness, confrontation, trust, authenticity, proaction, autonomy, confrontation, and experimentation, a specialized tool to collect data from health workers in primary health facilities, researchers concluded that organizational culture needed more focus by promoting open expressions and idea sharing. Further, primary health centers should not be put under stringent bonds, and staff should be allowed to partake in decision-making in order to advance the organizational culture. 17. Significant growth has been observed in the healthcare market in India, and both the public and private sectors are having dominance in the market. With the rise in the health industry worldwide, there's increasing competition among providers of modern health care. Government is focusing funds on health provision to meet the obligations to the people for the provision of quality health care. 18. In determining the relation between perceptions and how well hospitals perform, research was conducted, outlining that rules and regulations as well as empowerment were key to the organizational culture. Cost control and focus on customers have an influence on healthcare delivery and patient satisfaction. Management has the role of balancing the organizational culture and the dynamic environment to give the best output. 19. Attributes of organizational culture enhances the coordination of care in hospitals. Clan culture, according to research, can be adapted by management to improve coordination of delivery of healthcare in hospitals. Organizational culture was categorized under hierarchy, clan, adhocracy, and market. In study, service climate was tied to commitment to work and staff attitude towards patients during care delivery, and establishment of good relation and coordination among care providers significantly improves overall quality of care delivered. 20. Manpower has always been a challenge in the healthcare industry, and human resource personnel are on the edge when it comes to recruiting health workers, because the care offered to patients must not be compromised. Healthcare is in high demand in rural India, which constitutes a greater portion of the population, press on rising health managers due to weak staff strength in these areas. Doctors, nurses and administrative workers are scarce, and the output from the training institutions is not meeting the increasing demand. Attrition is a crippling force in the industry, and healthcare is suffering at the peril of the unfilled vacuums that the high attrition rate is causing. Health workers seeking for greener pastures and better service offerings does not reduce the demand for healthcare in the areas or facilities they leave. In the instance where staff refuse to modernize their ways and resist digitalization, quality care is put a number of steps behind. 21. With the aim of examining hospital organizational culture in relation to commitment to the hospital among nursing executives, a study was conducted which indicated a positive correlation between organizational culture in hospitals and organizational commitment. The higher the quality of nursing managers, the more positive impact it has on the organizational culture. Even though conventional training yields good results, good hospital culture promotes and enhances individual performance. In order to increase the overall performance of the hospital, management should be attentive to driving forces that increase effective, continuous, and normative commitment. 22. Reviewing low and middle income countries, and how their health sector reforms are influenced by organizational culture, researchers found distance in power, avoidance of uncertainty and in-group and institutional collectivism as dimensions of organizational culture which affect reforms in the health sector. Practices in the organization mediate these effects. 23. Organizational culture is a shaping tool for behavior and actions in an organization. In a cross-sectional study to understand the relationship between organizational culture and job satisfaction in primary hospitals, employees of hospitals were found to have positive work attitude in environments with innovative and clan culture. Key players and management must improve their work towards reinforcing social interaction of staff of the hospitals. 24. Findings. The review recognized organizational culture as very essential to productivity and quality healthcare delivery in India and across the globe. In both the government and private sectors, organizational culture was seen to influence staff behavior and patient satisfaction. The full implementation of organizational culture to the benefit of the citizenry goes beyond the confines of only management, but the entire staff strength. The complexity of organizational culture means that both internal and external factors act as influencers to the culture affecting the health sector. The issue of cost versus quality was also identified. Since the healthcare industry is patient-centered, the focus of all organizational culture is to attain excellent patient satisfaction. Health facilities who offer the basic care, primary health, should be given decision-making mandates, to promote organizational culture in the hospitals and health facilities. The culture existent in hospitals was found to play a pivotal role in hospital performance. Challenges that arise in the healthcare institutions also affect the organizational culture and in effect the quality of care. Staff shortages, attrition, urbanization among others are devastating challenges in health facilities. Health reforms were identified as being negatively impacted by poor work culture, and in low and middle income nations, these reforms are crippled. Conclusion. An understanding has been achieved on organizational culture in Indian healthcare. In conclusion, it can be established that organizational culture influences staff attitudes to work, delivery of care and overall patient satisfaction. All structures, policies, and traditions clearly outline the organizational culture of health facilities. Both subtle and notable changes in the healthcare industries, develop and transform the culture that is present in the sector. Since there's limited research in the area of healthcare-related organizational culture, scholars can take the opportunity to explore other areas of this subject area.